3D printing or additive manufacturing transforms digital designs into tangible objects by adding material layer by layer. Unlike traditional manufacturing, it enables intricate designs, fast prototyping, and personalized items using common materials. Some common materials are polylactic acid and polyglycolic acid. These are biodegradable polymers that are commonly used for devices like sutures and tissue engineering scaffolds. Polycaprolactone, a biodegradable polyester ideal for tissue engineering. Hydrogels are water-rich polymer networks that mimic the extracellular matrix. Biokinks are materials combined with cells to create liver tissue constructs through 3D bioprinting. Tricalcium phosphate and hydroxyapatite. These are bioceramics that support bone growth and are used in bone tissue engineering and dental applications. Titanium and titanium alloys, biocompatible metals often 3D printed for orthopedic and dental implants. In biomedical research and engineering, artists and engineers collaborate using advanced tools like CAD, blending art with science. This interdisciplinary approach, enhanced by 3D printing, has revolutionized personalized medicine, emphasizing patient-specific implants, anatomical education, and innovative drug delivery.
Around the world, thousands of people are on waiting lists for organ transplants, desperately in need of life-saving transplantations that may never happen due to insufficient organ supply. Researchers continue to work tirelessly to find solutions to this problem, and 3D printing may just provide the needed solution. The ability to 3D print human organs sounds unbelievable, but you should not dismiss it so quickly. A 3D printing process that would use patients' own cells to grow organs would yield many benefits, including a lower likelihood of organ rejection and eliminating the need for immunosuppressive medication post-operation. Over the last few decades, we have seen tremendous growth in this area. From 3D printed bladders in the past to now developing 3D models of heart components, we cannot be sure what the future holds for bioprinting, but it is certainly something worth looking forward to.
What are some educational benefits of 3D printing? Well, in developing students' clinical competencies, many medical schools struggle with obtaining human tissue in some countries and cultural circles. 3D printing presents an avenue to help them acquire some of these resources, such as bones. In a project conducted by Australia's Macquarie University and Western Sydney University, they added 3D prints of selected bones to their existing resources. They found that these 3D printed bones were successfully implemented in anatomical education and will continue to help medical education evolve. So, let's talk about the utility of these models for teaching. In a scoping review studying the role of 3D printing for anatomy education of undergraduate medical students, they found that it helps promote deep learning, as students can interact with the content directly and more readily apply the concepts to everyday practice. This is found to be helpful, especially for anatomy-heavy specialties like surgery. These prints are also versatile, and pathology can be integrated into the more complex models, useful for the scaffolding approach in the spiral educational curriculum. The next steps for 3D printing and anatomical education is the establishment of an online database of models created for specific educational purposes.
In the realm of biomedical research and development, 3D printing stands as a transformative force, especially in the domain of drug delivery systems. Through this cutting-edge technology, researchers are pioneering the era of personalized medicine, crafting drug delivery forms precisely tailored to individual patients' needs, ensuring optimal dosages and release rates. The intricate and complex geometries achievable with 3D printing have opened avenues for innovative drug carriers, previously unattainable through traditional methods. This technology facilitates the development of controlled release systems, implants, and capsules with specific porous structures, allowing for targeted and sustained drug delivery. Moreover, the ability to incorporate multiple drugs into a single dosage form simplifies treatment regimens, particularly in areas like cancer therapy, where combination therapies are paramount. Rapid prototyping capabilities accelerate the iterative design process, ensuring faster innovations in medicine. 3D printing also overcomes challenges posed by drug solubility, enhancing bioavailability and absorption. By utilizing biodegradable materials, implantable devices can serve their purpose without the need for surgical removal, reducing invasiveness. The continuous evolution of 3D printing technology holds promise for the future, with developments like 4D printing paving the way for smart, responsive drug delivery systems. Through these advancements, 3D printing is reshaping the landscape of biomedical research, revolutionizing how we approach drug delivery and patient care.
In our exploration of 3D printing's role in the biomedical realm, we've unveiled its transformative potential. This isn't simply about layering materials, it's about revolutionizing patient care, redefining education, and optimizing therapeutic interventions. Firstly, with patient-specific implants, we're transitioning from a one-size-fits-all approach to bespoke healthcare solutions, tailoring each implant to the individual, ensuring not just compatibility but also enhanced functionality. The 3D printing in anatomy also bridges theory to reality, offering tangible models from patient data, enriching learning and understanding for medical trainees. Lastly, 3D printing has revolutionized drug delivery, enabling researchers to design mechanisms tailored to physiological needs, improving efficacy and patient experience. So, what does this behold for biomedical research? It signifies a future where innovations are not just incremental but groundbreaking. It is an invitation to be at the forefront of a revolution, merging creativity with science and a testament to its ever evolving nature, a promise of advancements that prioritize patient well being while pushing the boundaries of what's scientifically possible. As we gaze ahead, it's evident that 3D printing is not just a tool, but a beacon leading the way to a brighter, more precise, and patient centric future in biomedical engineering and research.